Just checking we're on both. Last week I did my Facebook Live and I wasn't connected to Instagram, so it looks like we're good today. Hopefully that's true. Anyways, hello, I'm Kate McDowell from Align Natural Health, and I wanted to talk to you today a bit more about perimenopause. This is something that I've talked about a bunch of times, but it's also a topic that commonly I'm asked about. And I did a post a couple days ago that was talking about how giving the body synthetic hormones isn't going to be the solution if you're looking to get hormone balance. And there were a couple of questions that came up that I'm going to address today as well. And part of it was, as I'm going through menopause, doesn't it make sense for me to be on hormone replacement therapy? Which is something that's common and that a lot of women are dealing with and a lot of women are taking, and it can be beneficial for you in the short term when your body is going through some of the changes because it can help with symptoms. But ultimately, if we're just throwing medication at something, we're not finding out what the cause is. Why is your body not producing hormones properly? And so it's not going to help resolve that because we're not taking a look at what's the issue, what's the reason you're not producing hormones as you should be. And also, there's going to be side effects of medication as well. So, this is one of the reasons why I'm not a huge fan of throwing hormones at something because ultimately we're not fixing the problem and we could be giving you some more issues in the future as well. So, as women, our bodies go through a number of changes at different phases of our life. It's reality, but it doesn't have to mean that it's going to come along with a whole bunch of symptoms. We're at the point where a lot of women expect that because maybe you saw your parents or not your parents, your mom go through menopause symptoms, perimenopause symptoms. Your friends may be going through them as well. So we start to think that this is just normal. This is just a normal part of aging. And for a lot of women, they go to their doctor and say, I'm dealing with night sweats, I'm dealing with hot flashes, I'm dealing with low libido, or changes in my weight. And a lot of women that I've talked to, and I had this in the past as well, the doctor says, you're in your 40s. That's normal. That's a normal part of aging. Or, well, that's just kind of normal at your age, which doesn't feel good and is not helping with the problem at all. So, for a lot of women, the transition into perimenopause can be a difficult and confusing time in your life. And these changes can happen with the fluctuation that happens in our hormones during this phase, especially if stress is something that you deal with often. Unfortunately, many doctors, especially family doctors, they don't have the answers when it comes to hormones and the changes that happen to your monthly cycle during perimenopause. There are a few reasons or main reasons why your family doctor may not have the answers. Reason number one, there's a lack of time. Family doctors are often faced with a large number of patients that they have to take care of, a limited amount of time to spend with each patient. And so that can lead to kind of a lack of time to properly diagnose and deal with any issues that you might be dealing with. So that's number one. Number two, there's a lack of knowledge. Hormones are one of the most complicated things literally on this planet. They would have to go back to school and get another degree, essentially, and spend the same amount of time in education and schooling to understand the female body, especially the female body, as we're going through perimenopause and going into menopause. Hormone related issues are super complex and they require specialized knowledge. And while family doctors may have a basic understanding of hormones, they may not have the in depth knowledge that's actually needed to be able to diagnose and deal with any issues that are going on through this phase of your life. And then number three is a lack of focus. Typically, family doctors take more of a general approach to health. They can help you with a lot of different things, but they're not a master of one small thing. And hormones, in the grand scheme of things, is considered a small thing. But if you're a woman going through perimenopause, it doesn't seem like a small thing. I totally get that. So, Western medicine as a whole often fails to properly diagnose women during this phase of life, during perimenopause and into menopause, which is partly just a lack of understanding of the underlying causes of hormone related symptoms in women. As women age and approach menopause, their hormones fluctuate at levels. So estrogen, progesterone, testosterone are all going to vary in levels as we go through perimenopause, and they can become imbalanced throughout this time. So this can result in a lot of physical, mental, and emotional symptoms. And Western medicine typically will treat the symptoms that you're dealing with rather than the cause. So they maybe give you a medication, which is very important for mood regulation, for regulating our cycle, for all kinds of other different things in the body. And so if you're going through perimenopause and you're not able to make enough progesterone because you're under a lot of stress, this is going to cause a lot of issues for your body. So, estrogen is the one that's commonly blamed when we're having any kind of hormone issues. Estrogen dominance is something that commonly comes up, and estrogen is something that's linked to areas of weight gain and other things as well. But estrogen is not the whole picture here. And a lot of the times when women are dealing with estrogen dominance, it's not actually too much estrogen that's the problem, it's a lack of progesterone because the balance between estrogen and progesterone are the most important things for keeping you regulated and keeping the symptoms at bay. So, this is where, as I said, from a holistic perspective, what we do to align natural health is we use something called quantum nutrition testing. And the purpose of quantum nutrition testing is it gives us a tool to be able to test your whole body from head to toe. Western medicine will take your blood, or it will do an ultrasound or an MRI or some test of like a specific region of the body to see, okay, is there a problem here? Quantum nutrition testing and holistic nutrition in general is about seeing the body as a whole picture. So we want to know everything that's going on with you because if you're having issues with your thyroid, for example, it may not actually be your thyroid that's the problem. Your pituitary in your brain is where the thyroid stimulating hormone is produced. So if you've got thyroid issues because the body's not producing enough thyroid stimulating hormone that goes down and stimulates the thyroid to produce thyroid hormones, see what I'm saying here? It may not actually be a thyroid problem. So to scan the thyroid and not consider anything else in the entire body, you're not getting the whole picture. With quantum nutrition testing, we take the whole picture. We scan the whole body from head to toe. We check all of your organs and glands to see what's functioning well, awesome, and what areas are not and need some support. And from this point, we can test again and see what's the cause. Why are you having the issues you're having? Why are you having the perimenopause symptoms that you're having? Maybe there's something going on with your ovaries. Okay, so the ovaries need support. What's the cause? And from testing here, maybe it's something that you're eating. Maybe it's something in your environment, like heavy metals, like um, radiation. I'm on a computer and a phone right now. I live with radiation all the time. Radiation is a really big factor for people. Maybe it's other toxins, maybe it's parasites. There's so many different things that can be impacting and affecting our bodies. And when we can figure out what the cause is, then we can figure out what the body needs to help support it so that it can get back into balance. And when a body's in balance, you're not going to be dealing with symptoms as much as you are now because we're going to resolve the issues. So, understanding the root cause of the symptoms really is the key in providing the best care all the time, but especially for women as you're going through perimenopause. So, working with a holistic practitioner like us at Align Natural Health, myself and Amanda, we're able to do the head to toe testing for you, and then we can figure out what your body needs. We're trained to look at the whole picture and take a more comprehensive approach to healthcare. I can help you identify any imbalances that are there and what your body needs to get back into balance. So if you've been struggling with perimenopause symptoms, if you've dealt with the hot flashes or the night sweats or the low libido or changes to your mood is a really big one. Trouble sleeping, that was something that I struggled with for quite a while. I'm still not perfect. I'm still working on it as going through perimenopause. And weight gain is another really common one through this phase of life as well. But when we can figure out what your body needs to get back into balance, it makes a really big difference. So if this is something that you could use our help with, for sure reach out to me. I'm going to drop the link in the comments below so you can book your first assessment with us. In the assessment, we go through everything that's going on with you. We send you a symptom survey because we want to know everything that you're dealing with. And then from there, we'll test you from head to toe to see where are the areas that need support. We answer all of your questions, and then we'll talk about a strategy and a custom plan to move forward. This is not a one size fits all thing because we're not all the same. No one lives in the exact same body, in the exact same environment, with the exact same history. So this needs to be personalized. So that's how we can help you. So if this is something you're interested in, click the link in the comments if you're watching on Instagram or on YouTube. And if you're on, Facebook or YouTube, if you're on Instagram, grab the link in my bio, book an assessment with us. We can figure out what's going on with you. And a lot of the times, what we hear from clients when they start working with us is, no one's ever told me that's why I'm having the issues I'm having, but it makes so much sense. I've heard that over and over and over again. I mean, you can start to understand your body better. What's going on? Why are you having the symptoms? It it can give you some empowerment and something to move forward with, and it's really beneficial and helpful. So if this is something you're interested in, click the link. If you have any questions, for sure, leave them in the comments below. I will check back. I didn't turn the chat on this. Okay. I will check back later if there's any questions or comments. For sure, I will respond to you. And if you need anything, you can reach out anytime. I'd be more than happy to chat with you. Hope you have a wonderful day, and I will talk to you soon.